You're listening to Planet Vero Radio. I am Cindy Schwartz. We are talking about ways patients can be better informed about their health care. And on the phone, I have Professor Libby McNairn, who is the coordinator of surgical services at Gulf Coast State College. And Libby McNairn is also an RN and has 2 master's degrees, so pretty well qualified to talk about the topic today, which is surgical technicians. Libby, thank you so much for talking with me.
Thank you for having us.
This is a subject, Libby, surgical technicians, that nearly most patients have no clue about until maybe they get their bill and they see these people listed on the end of the sheet and say, who are these people? Because we all think, oh, it's a nurse that does this. That's another nurse. That's another whatever. But you don't really know who surgery techs are. So who are surgery techs and what is their function?
Okay. Surgical technologists are 70,000 strong in the nation. They are the persons who are trained to set up this sterile field, anticipate what the surgeon is going to need, pass instrumentation during the surgical procedure, assist with some minor duties, and can go on to become surgical first assistants who are standing across from the surgeon and actually assisting with the surgical procedure during the case. Those that are surgical first assisting are taught to do things like endovessel harvesting, closing wounds, assisting with the actual procedure itself.
And so how are these surgical techs trained, and how long is their schooling?
Okay. Surgical technologists, there are 390 schools across the nation, and they are trained in a variety of ways. Some of the programs are vocational, so they're about 9 months to a year long, and others are AS degrees. The move is for all programs in the United States to be 2-year associate's degrees by the year 2021.
Okay, and so are these, because of their schooling, some of it longer than others, and the AS degree certainly would be more involved of schooling, and I'm thinking that the surgical tech, the first tech, would have an AS degree.
They will in the future, but at this point they have a variety of either vocational certificates, college credit certificates, or AS degrees.
Okay, so it's not standardized testing.
Not yet.
Not yet. Okay. And also, are these surgical techs licensed? Are they registered? Are they certified? What are their qualifications to actually be in the operating room?
In the state of Florida, there are no laws or requirements requiring the person who serves as a surgical technologist or a surgical first assistant to be licensed or certified or registered. Most hospitals say certified surgical technologist preferred. Some will require it upon hiring, but do not necessarily require national certification to remain employed. Others will hire people who are experienced, grandfathered in, I guess you would say, but have no national certification. There is a national certification, and it is good in all 50 states, and people do study and sit for it, and to become a certified surgical technologist or to become a certified surgical first assistant.
Okay, so that's a national test, but it is not recognized in every state as a requirement.
Exactly.
Okay, and as a professor teaching these surgical techs, why do you feel that should be a requirement specifically in the state of Florida? Because that's what this conversation is about, geared towards the state of Florida.
Well, in the state of Florida and everywhere else, each person is responsible for their own and accountable for their own actions. There is no one person in the OR suite who can monitor the actions of everybody that's there. So each person needs to be educated, required to maintain that education, required to take an examination to prove that they have sufficient knowledge, and then be required to continue their education because healthcare changes so rapidly.
Mm-hmm.
And when you require at least national certification, that sets a standard nationwide for at least an entry level for someone to be able to function in that role.
Okay, so if I'm hearing you correctly, and then you just dispelled a rumor or a non-fact that I knew, is I always thought that the surgeon was in charge of whoever the team was in that operating room, that they were the go-to person and they were the last say. So if what you're saying, I hear that's not true.
Well, it depends. In some situations, the surgeon is able to request individuals to be on his team, but when it's the middle of the night, or it's we've got a hurricane blowing through, or some other thing happening, there's no way. You get whoever happens to be there at that point in time. And they do develop teams, but not necessarily are those teams always capable of being there or always there.
Okay, so you're talking to the qualifications of each specific team member, and so the surgeon then knows, the nurse knows, the circulating nurse knows, the assistants all know that each one of those people has their specific qualifications. Like you do as an RN, you have to take testing, you have to take certification. So you're saying with surgery techs now, to have national certification, that would be the bar that would be set.
That is exactly right. Because when you're talking to physicians or even others, they do not, all they know is that person is there to assist them that day. They may not necessarily know their level of education or training, or even if they are certified or if they do continue in education or not. They have no way of knowing, because the surgical technologist and the surgical first assistant that is hospital employed are provided to them by the hospital.
Okay, so that was my next question. Who are the people that are hiring these surgery techs, and who are of course, it's the hospital or whatever facility that they happen to work in, but who are the ones that are in charge of their whole critique? So it's whatever administration that's hiring them, it's whatever facilities administration.
Correct.
Okay, so they're not working with doctors. They're all independent people, independent medical personnel that go in and work for that facility, and the doctor and the nurse have no choice in the matter per se.
No, they can provide input, they can provide critiques, they can provide complaints, but they can't necessarily always choose who will be a member of their team for that particular operation.
And so the first entry-level surgery technician, and I don't know if I'm saying that word correctly, do they do cutting, suturing, shaving, or is that specifically to the next level of surgery tech? And what would the surgery tech do in the operation after they've set up the sterile field? Do they still remain in the surgery, the ones that are less schooled?
Yes, a surgical technologist, they function at the sterile field. They set up the sterile field, and they continue to do it. There is a move by most people and most facilities to move away from having people who are not certified do suturing, etc. That is considered the next level. However, I've had certified surgical technologists who have left my school and gone somewhere to go to work, and they're telling me that they're closing wounds. So it's not universal, and it may not be known by administration that a surgeon is particularly allowing people to do certain things during their procedure. So there's actually no control whatsoever. There's no state requirements or practice act for that person as to what they can do or what they cannot do. Most facilities and most surgeons take it under advisement that they can delegate whatever they as the physician in charge can delegate to that individual.
Okay, we have like a second left, Libby. I want to thank you so much. The information is invaluable. And just to patients, be educated and get as much knowledge as you possibly can. Thank you so much.
You're welcome. Have a good day.